Hey, welcome back, everyone. This is Barry J, and you are with the Black Fathers Foundation. We have started another panel. This time, we are talking to frontline dads. These are the brothers and the gentlemen that are on the front line of everything that's happening with this world we're living in, the new normal. And we wanted to have a conversation with the folks that are on the front lines, the folks that are dealing with stuff every day, the folks that have not sat at home, but the folks that actually have been leaving their house every single day for the last 3 to 4 months. First person I want to make sure I introduce, and hopefully I get his name right this time, Pierre Dolcine.
Yes, how you doing?
Oh, please tell me, give me the thumbs up. It's like almost there, brother. Almost, my man, my man.
You got it. You got it.
Pierre is a United States Marine Corps veteran, 18-year member of the Baltimore City Police Department. He serves on the BPD's hostage negotiation and crisis intervention teams, and he is a peer mentor. Thank you, Pierre, for blessing us today. Thank you very much, brother.
Thanks for the invite.
My next guest is Gary Crum. Gary was born and raised in East Baltimore. He's a community leader and advocate in the Oliver community. He's married to his beautiful wife and has two beautiful kids. Thank you, Gary, for coming on with us today. Thanks, brother.
Thanks for having me.
My pleasure. My pleasure. And I had to switch it up a little bit. Melvin Hopkins. Melvin was born and raised in Baltimore. He's a firefighter and a paramedic for the Baltimore County Fire Department, has been one for the last 21 years. Melvin, thanks for, I know it was the last minute. Thanks for running in here, jumping in with us, brother. We appreciate you.
No problem. That's Baltimore City, not county.
Oh, Baltimore City. Forgive me. Forgive me. We'll make sure we go. And look, we'll get that right for sure. And let me see, we second to last guest, Mark Winkler. He's a family man and a family advocate providing guidance, leadership, and advocacy via his nonprofit organization, Manhood Camp. He is most recently an author. Manhood Camp was founded by himself and Trayvon Tills. They provide lead life skills programs and community service opportunities that encourage young men in Los Angeles region to be well-rounded, healthy, and productive citizens. Thanks, Mark, for joining us today, brother.
It's a pleasure to be here. I look forward to the conversation with these wonderful brothers.
Oh man, thank you very much. Thank you so we're gonna jump right into it. We're expecting one other person. If they come on, excellent. If not, we're gonna run right through this. First off, I want to ask you guys right off the bat, and whoever wants to jump in first, how do I put this? How has the new norm changed your life and the line you and the work that you do now? How's that changed?
Well, I'll jump in. It's funny, the new norm, we hearing that a lot, and we thought we were actually moving out of the new norm, but here in Los Angeles, Governor Newsom just declared that we're going to go back to a modified versions of the when we went on the lockdown. So I guess our new norm has been extended, right? And so for me, it's been an experience because I'm the father of three girls, and for me, just having to adjust life with the family first has been a change. We went into lockdown back in March, and that meant the schools closed. So we had to adjust completely to this, everything being in the home, right? And so we had to make sure that we were fortified in our homes. When I say fortified, I meant that we had to have a lot more communication. We had to make certain that we were all on the same page because what we didn't want was the tension of being in lockdown to cause unnecessary family upheaval. And the work that I do, I was holding a weekly fatherhood meeting. So when we scaled that down and we had to go online, it was challenging because some of the guys came in, some of the guys didn't. But now that we have a rhythm going within this new norm, we have almost full participation from the fathers to support fatherhood group that we do. So it's been challenging, but it's been an opportunity for growth. It's been an opportunity for growth.
Excellent. Thanks, Mark.
Hmm.
Gary, you jump in there.
For me, it's been a blessing. It's it's been sort of a curse a little bit because I'm actually been out of work since the pandemic hit because I work in the school system. So I had to I was laid off back in March, but the blessing of it has been that me being home with my family more, uh, and like you said about school being out, I was able to you know be here with my son while he do virtual learning and helping him with that. My wife is who was working from home, so I have to be able to watch my 1 year old and keep her out the way while my wife be able to do work and stuff like that.
I don't think I can hear.
But
For some reason, I can't hear Brother Guy.
You can't hear him? We can hear you, Gary. We can
We can
hear
hear
you.
you.
oh,
I can hear you.
I can hear you. But I can't. I
okay.
can't hear him. I don't know for some reason.
But yeah, that's been like I said, it's been a blessing and a curse. But more for me, it's been a blessing. And uh, I like I said, this is I think going forward we're going to be in a we're not going back to normal. I think in
Come
for the
on.
next couple of years we're probably going to be living in some sort of way, virtual learning and making sure we social distancing and but I think it has helped a lot of families who haven't had a chance to understand how important it is to uh, the school system is because now the parents have to become the teachers and have to help guide their kids through a lot of things dealing with school. So hopefully a lot of parents are more engaged with their kids and dealing with the school system.
I couldn't have said that better, brother, because I can tell you right now, I think the teachers should get like a 300% increase on their salaries right now from what I had to deal with my two little ones.
I will vote for that as well.
Man, look, I'm telling you, I'm like I always, you always believe the teacher, but then your children will come home and say, they said I did this, and you're like, really? Okay, now I believe the teachers outright because I know how lazy my daughters are now. So, man,
Yeah,
my
absolutely right.
daughters be tripping. I was like, okay, let me hear from you, Pierre.
Well, for me, the new norm, technically, I have to separate work and family. The problem is, well, like I said, separate work and family because once work is done, 8 hours is done, now I have to fall back into fatherhood, being there for my wife, being there for my son, and then just like Gary said, now distant learning. My son has algebra. Now I have to go way back, go to YouTube, try to find out, okay, how does algebra even begin? And then push him, make sure he gets up early, 7 o'clock, or pick a time. Hey, you got your class, you got to do this, you got to do that. Give me a set time. When do you think you're going to get up? Because I know you're not going to get up at 7. So give me a time so we can start your day. But also know these hours that we set are the hours that we're dedicating. There's no PlayStation, this and that. And then
Mhm.
once that's over with, now that we're in this confined environment, house to be exact, we have to pay do the whole PT, running, extracurricular activity, make sure he doesn't fall and make sure he doesn't fall into depression or because that's what I'm beginning to notice. Even during work, some of these houses that I've gone to, some of these kids are falling into depression. They're doing the same mundane thing over and over again. They need activities. They need something to do. They need something to stimulate their mind.
Wow, wow, that's actually key. It's funny you said that too, because I know for our home that separation of trying to work virtually and keeping folks away from somebody else while they're on the computer, or I'm doing virtual training or a virtual course, and my wife's doing the same thing, and then we're trying to make sure. And I know in the beginning, I just said, "Here's your tablets,
Right.
go," just till we figure this thing out. But it you realize as you to your point that they need that activity, they need that stimulation, mindset wise. And Melvin, I haven't heard from you, brother. So tell me how it's affecting you.
Well, life is. Can you guys hear me?
Yep, we can hear you.
Yes.
Yep.
Life is. It hasn't changed much. Basically, the day to day, back and forth. I guess my kids are grown, so they are either at college or like they are living with their mom through the college and everything because they're back home. So what's really, I guess, the worst part of my day to day norm is actually just dealing with the citizens that we have to deal with that go through the COVID activities and everything. It's strange. It's strange because now, like you said, the new norm. It's like your mask. You have to gown up. Anybody with a confirmed COVID case, you have to gown up because you have to protect yourself. So, I mean, it's kind of how do I say, nerve wracking that every day you got to go around like this every day. You know what I mean?
Right.
It's just having to wear a mask everywhere. It's sometimes you may go and you may forget your mask, so now you got to start all over. And you got to go and go back and get your mask just to start your day. So the new norm, I'm kind of getting used to it. It's kind of easy. I don't have little ones, and Lord knows, like big shout out to you guys that had got the little kids that you got to be teachers to. Because no way, no way. Like I said, one of my daughter has a set of twin boys, and man, they go through it every single day, yelling and screaming, hooping and hollering. And I guess some of these runs that we go on, and like the brother was talking about earlier, you go into these homes and what we forget about is like the mental illness part of these kids. Where some of these kids looked in school was everything, getting out of the house was everything, and now they're in the house with the problem for 24 hours, 7 days a week. So, those are the kids that you really gotta like pray for and look out for because they're in the house with the problem. So I
Correct.
can't imagine what they're going through.
Hey, Melvin, you brought that up. That's a perfect segue into what I want to ask next. And Pierre, you mentioned this earlier. The balance of going from work to family. How's that changed? Like I know for me, especially when this first began, when I had to go out, either go to the grocery store. When I came back home, I wouldn't even like before I hit the door, I was practically coming out of those clothes that I was outside in because I
Yep.
didn't want to bring anything inside.
Right.
And it's like your whole mindset is changing. I'm washing my hands. I've already put hand sanitizer on it while I was in the car. Now I'm getting out of the car. I'm going into the house. I'm taking all the clothes off that I had on, shoes and everything, leaving that there, or going and that goes straight into the washing machine. So some of you fellas, I mean, you gentlemen, like are like Pierre, you're law enforcement. Then we have folks that are community activists, straight on the front lines, working with folks that need this help. We have paramedics in here. Tell me, how's that affected you when you are transitioning back home? Because that's a serious kind of a mental check mark where you have to go into a completely different phase.
Well, you actually broke down the transition. It's literally what you said before. I get off of work, uh, park my car. Literally, as soon as I get through the front door, I'm taking my shoes, taking everything off, setting that clothes aside in a waste bag, in clothing bin, and then we have a downstairs shower. Make sure I shower every day. It's not like I shower every day now already, but now you got to pay mindset of
We're not editing it out. I want you to know that, right? We're not editing that out.
I'm contaminating. Just like take all the stuff, the mental anguish and everything out, and then have a different set of clothes in the bathroom, and then rewash my clothes, and then just do the whole step all over again.
That's a serious transition, though, right?
Yeah, it's a lot. It's a lot, especially when after a while, they say it takes 21 days for you to build a habit, but the first the first 10 days it was hard. It was really hard. Just to, as soon as I open the door, you just want to unwind, go upstairs. What you need to do: cook, drink, watch TV, Netflix. But you literally have to break it down. Okay, as soon as I walk in, A, B, C, or D. These steps need to be met before I go inside the house or before I even greet everybody.
I think what made I think the transition to the new norm. I think what made it difficult for some people was that was so much information coming out from different sources. You had CDC saying one thing, you had the WHO, the World Health Organization, saying another. You had the federal guidelines and the state guidelines, and there was not always a cohesive message. So when you start out one day saying, okay, things are not as the virus is not as transmittable as it is, as we learn now, there was less things that we did. So that 21 days we were getting used to one thing, and then all of a sudden we were told, well, you possibly need to wash all your food down that you bring in. So we had to incorporate that into the lexicon of what we were doing. And so I think hearing all these different messages made the transition from just what we were used to this new sort of understanding of how we should live, because we were getting our psyche was getting bombarded with all of these different messages. I just want to say one other thing. I think Pierre said this, and Melvin touched on it as well. You know, I'm a father of three girls, so there's a certain routine and there's certain things that I've gotten used to. But I think about, and that routine helped them to make the transition, working with myself and my wife. But I think about all the children that the American Academy of Pediatrics talk about, that Pierre talked about, that Melvin talked about, that don't necessarily have the opportunity to get the sort of mental wellness that they receive in school. So, you know, I'm very conscious of that when I speak to the fathers. You know, I don't just assume that things are okay for them as they are okay for me. I'm very conscious that there's different dynamics happening in different homes, and we have to be conscious that, you know, even though we may be making the transition smoothly, there's so many families that are not making these transitions as smoothly.
Let me hear from you, Gary.
Yeah, so the first month of this pandemic, I believe the paranoia for a lot of folks, including myself, was very, very high, based on the information we was getting, far as how it was being spread and things of that nature. Uh, but the last couple of months, myself and my wife, our paranoia hasn't been so high. We're still taking the precautions of washing hands, making sure we wear our face masks and things of that nature. Um, but uh, but yeah, so I I, I work part time at a Shepherd Pratt hospital. That's why I work at part time, and going into that type of environment, being confined in an area, we had a lot of COVID-19 cases there. Um, but it was a lot of precautions set up and things of that nature to be able to make sure the staff and the clients are protected. But it's always in the back of your mind that if what happens if you get it, you bring it home and things of that nature. But you know, having an essential type job, just like some of y'all guys, we the things that we must do, and be able to serve and to provide for our family as well.
Thank you for that. Thank you for that. Melvin, did I get to you, brother?
I didn't. I can't hear. I can't hear Brother Gary at all.
Oh, okay, okay. Um, so tell me how, like, as a paramedic, man, like you're seeing things. You touched on going into places and seeing children that are depressed or dealing with that. Tell me how that affects you. Like, you still have to come home. How is that affecting you? That work life balance for you?
Uh, well, being in the job for as long as I have been, you kind of know how to turn it on and turn it off. Uh, I can. I forgot the brother's name. That's the police officer. You got like it's a gear. You have a gear. You turn it on now. Now you have to be a lot more careful with just everything that you do. Wash your hands. Wash your hands. Wash your hands. And then the other brother touched on. I don't want to keep saying this brother, that brother, but I'm not good with names at all. Even if I see him, I'm gonna forget him. But what's happening is we're so misinformed. Me personally, I never believed the numbers. Like and just living in the city that I live in, and you see what's going on, and for working in the city for as long as you have, you kind of got an idea. And you can only in my job and as a police officer, you got to go with your gut. Okay, you got to go with what your gut says. Yes, they can be giving you all of the information, but you got if you're seeing it with your own eyes, and at one time there was all of these crazy numbers with people with COVID, and our call volume was down. And I'm like, okay, well, how is that possible? Because we're the ones that's taking most of the patients to the hospitals, and you have to go off of what you hear, but you also have to use common sense also. So I guess the transition, I guess basically number one, you have to protect yourself, regardless of whatever you do throughout your day. I understand that that's a patient, but just like a police officer, we got to go home at the end of the day, and we got to be safe. We got to be clean. We don't want to be the ones that's transmitting it to our families. And what a lot of people don't know is, you have to realize they don't look at it as it's their emergency. Okay, it's me, like an opera singer. You have to take care of me. But they're not thinking about, yes, they may have the COVID, but they might give it to you. And now it's a chain reaction. So I guess number one, just being safer at work. We're always safe, but now we have to be extra safe because if, like I said, this thing was real. I'll be the first one to tell you that I was a non-believer. I did not believe it. I did not think that it was going to get as bad as it is now. I'll be the first one to tell you. I said, you know what? Excuse me for saying this. I was like, man, black people ain't going to get the COVID. There's no way that we're going to
Oh, Melvin, you just opened up a whole question for me now. Look, I had this other question. Now I'm like, all right, so anyone else on here feel this? Did they feel the same way as Melvin felt originally, or did that? How's everybody talking about that? Tell me something.
You know, me and Melvin, I don't know if you remember me. Well, our path has crossed. We've been to a couple of. I've seen you in a couple of accidents, couple of Sedona, like Frankfurt and Sedonia calls.
Yes.
So that being said, and in that community that we work in, it's African American communities. But
Right.
like Melvin said, it's all about them. It's their nucleus. They're important, and this is it. Whether they believe it or not, whether they have it or not, at the end of the day, they want that attention. Whether it's burn, cuts, domestic issues, cough, which they think is not COVID related, but then they want to get tested. Whatever the criteria is what we can do for them, how we can make them feel great, good, or indifferent. But it's all about them. So when we get there, we still preparing ourselves. Okay, first and foremost, we say to ourselves, he or she might have it. So before I even get in that contact or continue this conversation, let me pretend that he has it until he or she breaks it down that, okay, they don't have the symptoms, they don't have the cough, whatever they have, whatever they're suffering from is either they're either delusional or suffering from postpartum depression. There's a whole gambit of it that we have to that the COVID that the COVID resembles. So there's a whole gambit that we literally have to break it down piece by piece by piece. But regardless, the calls that we go to, whether it's 10, 20, 15 calls, that person wants that immediate attention. And they don't talk about the COVID. They want to know what can we do for them.
Wow.
Yeah, but
Wow.
well, my thing, not to cut you off, but brother, my thing is everybody's got it. Until you
Right.
prove me wrong,
That's what
everybody's got it. Everybody.
Yep, that's how I treat it also. You have it.
Gary, let me hear from you, brother. Gary, you look like you gnawing at the bit. Gary, go ahead and say something, brother.
No, I was ready to say that I wasn't. It wasn't that I was a non-believer because when the pandemic first started, Baltimore City only had about 2 or 3 cases, and then what happened after a while, it started to hit close to home because then I knew a few people who caught it and who eventually passed away from it, and then I was like, wow, man, yeah, this is it's getting serious. Um, in my opinion. I believe, and this is just my opinion, I believe that half of the country is probably walk around with the coronavirus. It's just that they asymptomatic and they don't show no sign. And as long as we keep testing uh, people for it, the cases are going to continue to rise. That's just my opinion.
Mark, let me hear
Yeah,
from you, man.
Yeah, you know what? I think I agree with both Pierre and Melvin. I think we have to assume everyone has it until something happens that either there's an effective treatment. I know I'm gonna say something that's controversial. There's a vaccine. I know some people don't want to take a vaccine, but until we have more information, I think I agree with the brothers. All three of the brothers. We have to assume that everyone has it. Now, going back to the conversation about Black people not thinking we can get it. Well, in the beginning, we were looking at numbers over in Africa, and we were looking at the countries over there, and the numbers were so low. And so we were thinking, this doesn't affect us. This is not going to affect us, because as the breakout started to spread in different states around America, it wasn't hitting the inner cities where a lot of brothers and sisters populate. So naturally, we thought, well, it's not going to, it's not really affecting us, right? And so we had that idea, but as numbers started to grow, and we went from thinking that we don't get it to hearing that we were a vulnerable population. So again, that's that information flow. I think if we had information in the beginning that everyone is a potential carrier of this virus, including children, and children can be affected physically. It could harm them physically, and so they won't just get it and it just pass through and not hurt them. With that type of information, as that information was coming out, if we would have had that information, I think we could have, the numbers that we're looking at right now would not be so high, but we were not getting the type of information we needed to really structure an effective plan to deal with this. But I think now that we do, I'm happy to see when I'm out and about in the community, I see a lot of my brothers and sisters wearing the mask. Some of the younger ones, not so much sometimes, but we have to work on them, because but it's, I don't blame them completely, because they were told, it was drummed in their mind that this is not a disease, this is not a virus that affects young people. So it's about re-educating and then being consistent.
Indeed. So I'm gonna go a little further with this, because I do remember at some point when it became about our community, where they were
Mhm,
saying because the African American community has so many underlying conditions that we were
mhm,
vulnerable to it. I actually started running into people of color that were offended that all of a
mhm.
sudden it was about us. Now, did you guys feel the same way, or did you hear it when you're in your communities hear the same thing, or am I by myself out here? Because some folks are like, why they got to be talking about our community like that? I mean, like anybody can get it.
But understand, Barry, when they were talking about the Black community, they were talking about the underlying conditions were hypertension, obesity. So if you tell somebody, well, only obese people could get it, and the majority of them are obese, or not, or that person that's the low self-esteem, they're gonna be offended. Like, why me? I don't exercise. I'm not jogging 3 miles and a half around Lake Montebello. So they're gonna take offense to it. So
Mm,
what? Oh, I thought somebody was saying something. Oh.
Oh
So
no.
once they find out that it's if it literally you picking at them, it's going back to grade school when you start picking at the chubby kid. He's like, oh, you got this, you got this, you got blah blah. Then he's like, all right. Then he takes offense. He starts taking offense to it. But then if they said it only happened, no offense to anybody, to only light skinned people, then all right, okay, cool, all right, then we'll move on.
Mhm.
right, right,
I think the light skinned people are.
yeah,
Yeah, I brought it up,
Yeah,
Barry.
light skinned.
yeah. We're gonna have a part
Light,
two to this.
light
You
skinned
Yeah,
frontline
people.
dads.
I,
Go
I
ahead,
mean, I
Melvin. I'm
think
sorry.
I think a lot of. I mean, my thing is they were putting a scare on like the elderly. When they were saying like the elders and the people with the underlying issues, because it was giving respiratory problems. And you got to look at. I mean, just look at our community. Asthma's on the rise, obesity or COPD. I mean, I think the last time I was at work, we had 4 calls, and out of 4 calls, 4 of them was people with breathing problems. They had either asthma, COPD, or some type of lung issues. And then with lung issues come heart issues. So if it's attacking your immune system, your lung and your heart, there you go. I understand how people got upset, but I mean, look at it. I mean, obesity, eating habits. And one thing that I can say, thank you for the COVID because you're seeing so many of our brothers and sisters out there on bikes and exercises and working out. I mean, I've never seen so many people walking Lake Montebello in my life. I
Same
mean,
here.
now you can't even get a bike. You can't even like the list to get a bicycle is what is I think it's like maybe October because all of the stores, the pawn shops, all of the stores, like now you got little kids bikes going for like $500 on the Facebook Marketplace because it's such a hot topic. So it's really in a bad way. It really scared people, but it scared them to get in shape. I've never seen so many people working out. Like now everybody is taking their health it's like life or death now. And I guess we have the COVID to thank for that.
Wow. Wow. So there's a
Mhm.
positives coming out of this then, right?
Mhm.
Yes,
So
very
actually,
much
that's
so.
like Melvin. That's like the third time you set me up, man. I got a nice little transition with you, man. We're gonna put you on here for regular, brother, because you're doing it. Because I'm gonna bring in Jalil Johnson. He is a healthcare provider, educator, and an advocate. Greg, if you let me know when we can bring him in, because I would love to get his opinion on what we were just talking about. Because Melvin, you're seeing that folks are walking, they're biking. Like I didn't know it was a shortage on bikes over there. I had no clue. I mean, that's a plus right there. So Jalil, thank you, man.
Definitely.
Welcome for and we appreciate you jumping in here, and hopefully you were able to catch up with us and see what we was
Yeah.
talking about. But we would love to get your opinion as a healthcare provider of and the first question was our community got a little offended when we started focusing in on the fact that we had all these underlying conditions. And
Mm.
to Melvin's point, he's never seen so many people working out. We're seeing some positives come out of because folks are walking. I mean, I will admit the park in my neighborhood, folks are just circling in their masks, walking around. So tell us what
Right.
you've seen from your perspective.
Well, I mean, I think, can you guys hear me okay?
Yep, we can hear you.
Yes.
All right. So I think that, well, first of all, I appreciate all of you and I appreciate you, being here. I'm sorry if I was a little late coming into this, but I think that I see it from a couple of different vantage points. Um, as a person who is providing care to people in community, and just for context, I work in underserved communities intentionally, mostly with our community with people of color. So for providing care to people, I agree that there's a heightened awareness of one's own health. People seem to, for many reasons, I think, to be um, engaged, I guess, in conversation about their own health or thinking about it. It could be because they have more time. It could be because the world is literally in the middle of a pandemic. Lots of factors, but people definitely seem to be more engaged, but also really worried. You know, you'd be hard pressed to find a community where you didn't know any old people, or people who were immunocompromised, or people who might be susceptible to COVID-19. So everyone knows someone who could die from COVID-19 or has become ill with the virus or whatever. So I think people are just really aware. I think it's a good thing. That's from like a healthcare provider standpoint. Personally, um, I've seen just the pendulum swing all over the place in terms of just like absolute fear, paranoia, to now, all of the work that's been done to like control the spread, being somewhat undone by people who feel like it's not a big deal anymore. That's also happening sort of in step with the other people who are more aware, if that's helpful.
Appreciate you. And Mark, you're out in LA, correct?
Yes.
So
Yes.
you guys have backslid, I guess. You're going back to you kind of opened up a little early, but now you're heading back. So tell us how that's affecting you guys. I mean, because mentally that's got to take its toll because the anxiety was
Yeah.
different when in March where the weather was a little off. So you really didn't feel like
Yeah.
being outside, but now the weather's breaking. Folks want to be outside, and so give us some insight into that.
Well, yeah. So, like Jalil said, I think people were they had a heightened awareness about once the flow of information started coming in. and people were able to start making certain adjustments, and those adjustments helped them to be able to sort of get into the flow of this new normal. And California was doing great. I mean, our numbers were staying low. We were able to move into phase 2 of the federal guidelines for opening up, and we did that. And I think what happened was, because of the information not being as consistent as it should be, and there were rumors that the sunlight, the ultraviolet lights, will keep the virus at bay, or it can't be transmitted as much. The Generation Z, generation millennials, were still under the idea that somehow they were not going to be as negatively affected by the virus as some of the older population. That some of that thinking was still around, and so yeah, the people start hitting the streets again, man. And then, you know, they hit the streets, but they started to relax on the guidelines. They were not social distancing as much. We saw, you know, instances of people having house parties, man. And the house parties, you didn't really see a lot of masks being worn. You didn't really see a lot of social distancing. Ironically, not ironically, but funny, you saw them at doing the protests. You saw that they were wearing masks, but at these various house parties, you didn't see that. So yes, as of today, Governor Newsom announced that we're going back to a modified version of what we had before with the lockdown. And the superintendent of schools, I think his name is Andrew Benoit, something like that. He just announced that schools are going to be open August 18th, but it's going to be online. So I think what's going to happen is, yes, I think some of that anxiety is going to come back, because with that, schools being closed, and the fear is, well, if I have to work, where's that going to come from? Where am I going to have, you know, the opportunity, or will I have enough money to get a child sitter? So some of those fears, I think, are going to start to bubble back up to the top.
Thank you for that. So,
Can I add something to that? To just
please,
kind of
please do.
dovetail on that just really quick. It's interesting that, you know, in the age of information, you have a lot of Google scholars out there all of a sudden, and people, rightfully so, are able to access information, and then there's a lot of assumptions being made. Now, you can look back there. We've had this in the history of the world, but in just in our recent history, we've had viruses that have been difficult to understand in the beginning. HIV being one of them. Dr. Fauci was on the front lines of figuring that out. So in the beginning, there were all kinds of ideas about HIV. Over time, the science got better until now. Here we are, you know, decades later, and HIV is a chronic disease that can be managed, and people don't actually all die from it as the way they used to. And in a similarly, COVID-19 is a virus we don't know a lot about. So we're learning about it week to week, month to month, and the science is moving fast. And I think that to lay people into some people in the public, it makes it seem like the experts don't know what they're talking about, which is just a scientific process of coming up with an idea, proving or disproving it, and then making, you know, doing that process over and over again. Whereas, you know, back with HIV, sure, that was happening until they got better science. And now everyone has access to information. So people are literally saying, these people at the CDC or the World Health Organization or in the government or even, you know, federal, state, local government, they don't know what they're talking about. I'm just going to do my own thing. And that's just really scary. And then my second point is that just to kind of jump on the part about younger people feeling like they're not going to be susceptible to this pandemic or to the virus. I mean, at this point, what we know is that that's somewhat true, except for people can be asymptomatic and transmit that to someone who is very susceptible and dies. And I think that way of thinking about it, it's really misleading to think, oh, my chances of surviving are really good. But we think about our grandparents or our immunocompromised kids possibly not being strong enough to survive. So those are just my thoughts.
Yeah,
Appreciate that.
All right, now can I piggyback over Jalil? Hello?
Please do, please do.
So Jalil is 100% correct. But what I find most effective in the Black community, because when I was in Africa, there was the outbreak of the Ebola, and the way that they were hitting it is through the school system, letting education pamphlets continuously handing them out, telling, hey, tell your parents this, tell your grandparents, and if they have any questions, I'm going to knock on their door. Is it all right for them to expect me from 3 to 4 o'clock? Hey, for me to give them pamphlets, but and we need to fall that's what needs to fall back in the African American community, because, like Joel said, there are so many Google experts, and it's not until you confront them face to face and say, why do you think it's a conspiracy? Why do you think it's such a B, C, or D? And once they tell you that face to face, then you could prove them otherwise. This is what statistics says. This is how everybody's catching it, because they have African American community. We have to have somebody up front to tell them what's going on.
It's funny you said that. We're talking about this research because everyone's a researcher now, and everyone is their own
Expert.
encyclopedia or expert. Thank you for that. And my son, I'll talk about him all day, every day, just because I can. Um, he is the conspiracy theorist, and he finds all that stuff, and I'm like, where do you find this information? And you're spreading this information. So if it's not from WHO, World Health Organization, or the CDC, then if you're getting it from some off-brand website, and just because it's in print, you want to believe it, and that's what you're sharing on social media, and that's spreading through all these other, the anxiety, the depression, and other folks are reading this. And I have to tell her, you have a responsibility to make sure that the information you are conveying is correct. So, we go back and forth all the time because that world, he's not the millennial, he's Generation Z, I think it is, but which is after the millennials. But it's it's amazing to me, like they expect if it's in their phones, it's real.
Right.
Yeah.
Yeah, I think to piggyback off of that, Barry, like like you said, everybody's a Facebook scholar now. Like everybody knows everything about everything, and like I said, if it's on the internet, it's real. It has to be real. It's got to be real, we're in the age where everything has to be posted, like everything. We go through so much, and with myself and I think myself and Pierre, like every time we go on the scene, it's a camera. Like you can't even do CPR without a camera. So if they're gonna record the worst days of somebody's lives. Lives are easy to record, easy to post. I mean, I remember most of our information, like let's go way back. We used to get from the elders. The elders used to keep us up the par. It's like, you're not supposed to do this because of that and this, that, and the third. And then when we were old enough, now we can research and find out. But now these kids, you got 9 and 10-year-olds with Facebook pages, and now they're the new Facebook scholars at 10. You got a 10-year-old. I like the 2 7-year-old twins, my little grandbabies. That they can tell me more about the COVID than I'm sorry, 6 years old, and they was like, Pop, guess what? Well, the COVID is doing this and doing that. Well, where'd you find that out at? On YouTube. So like these little kids, and they have access to these tablets, and what people are doing is, I feel, is that they're spreading fear. Like when they said the African American community, to go back on that, to say, hey, look, you guys are gonna get it. And now you're saying, well, I'm really gonna stay in the house now, but, it's fear. But it's one place in Baltimore that you can't scare, and that's Pennsylvania Avenue. Nobody's scared. You can drop COVID all down there in the streets, and nobody's gonna get it. And that COVID's gonna run out of there. So for right now, I'm the first one to say the vaccine to the COVID is on Pennsylvania and North, down in the south.
And I just wanted to, I wanted to say something on behalf of the millenniums and the younger generation. I think a lot of what they do for us going to Google and things of that nature is because of the lack of trust that we have for world leaders, politicians, local, state, U.S. Congress, whatever, et cetera, et cetera. I think the mistrust that the young generation have for our leaders causes them to try to do their own researches, and even though it may not be official, they feel as though that they don't trust what's coming out the mouths of politicians, so they'll rather trust the internet instead.
I agree with you on that, Gary, wholeheartedly.
Hey,
You're
Barry, can
not
I say
right.
one thing to that?
Please do, please do.
You know what? I think there's a couple of dynamics that I see here, right? I think with this country, there's a history of individualism, right? So it's not so much what's best for the whole, it's what's best for me, right? So I think we operate somewhat, white, black, across the board. We operate from that perspective to different varying degrees. But then you take that and then you put that in the context or the atmosphere of inconsistent information, right? So even though you have information coming from the WHO, coming from CDC, coming from John Hopkins, you still have your state and local governments, politician leaders, political leaders, saying things that may counter that. So you're looking at the news one day and something comes out from the
Mhm.
CDC saying you should wear masks, and then you're looking
Mhm.
at one of those Corona task force meetings that were going on, and they were saying you shouldn't wear masks a couple of months ago. So in the absence of consistent information, and then people thinking, well, I got to do what's best for me, they're going to look and they're going to seek out information that best helps them and their family. So what I have been seeing that gives me hope, I have been seeing a trend towards people looking at what's best for the whole, right? You see these different clips where people come into the stores and they don't have a mask, and then there's sort of a collective chastising that they're giving to those people. So I do see a trend towards people thinking outside of that Walt Whitman sort of rugged individualism, looking towards what's best for the whole, because we know that if we don't do that, we're going to be locked into the situation for another 3 or 4 months. And most people are not financially equipped to be able to sustain that.
Indeed,
And
indeed. Well
to
said, Mark.
piggyback,
Mhm.
can I say something, Mr. Barry, real quick?
Please, please, please go ahead.
To piggyback off of what Mark said, I agree with you 100%, brother. But it's always that one that's going to stand in front of that store and say, I know my rights, and I don't have to wear a mask. What they call them? They call them Kerns. They call them Kerns. Right?
Parents, exactly.
Yeah.
Earns, right?
Kern gonna stand right in front of that store and say, listen here, I got rights, and I don't have to wear this mask, and you're not. I'm coming in that store whether you like it or not.
Right.
And now that's when we have Kern getting dragged out of there. That's where that goes. But I'm gonna go with Mark. Mark has a phrase that pays today: inconsistent information. That's what it is, and that goes with the fear, the scaring people and just telling them the right and the wrong and who to believe, and also brother Guy. And it's like everything wrapped in one is that we don't trust the politicians, but we also have trust issues with trusting ourselves as people.
Indeed. And I purposely, when I said CDC and who, I'll listen to them before I'm listening to my politicians. Because John Hopkins, that's what they're there for. They are not political. They're just giving me what the rundown of the numbers. I'm sorry, I cannot go by what our now. I have to say, Maryland, they've been doing a great job, especially in Prince George's County. I've seen like our numbers are down, and so I like what the politicians are doing there. But when it comes to like who I need to listen to, I got to go with the science first. That's just for me. That's because they're going to give me just the facts, and they're not going to give me what's based on the numbers of money.
But
I
you're
think
right, Barry. But you're educated black male. But what about those that are not educated? They keep falling back to falling back to the Google,
Yes.
their friends. But now, just like J- Jalil said, well, to piggyback what Jalil said, when we had, well, I'm originally from New York, so when we had that AIDS epidemic. How were they hitting it? Through information. They had I forgot, all the stars got together and started doing the Live Aid or whatever,
Oh, that what Live Aid, World Aid, something. Yeah, yeah, yeah.
all that aid.
You dating
That
yourself,
was
man. You dating yourself,
right. Yeah, I hope you're the only one that's watching this.
right?
Yeah, so that Live Aid. So you had the actors. What was it? Actors, a whole bunch of people of authority that got together, and they all had that one platform. And that's what we need to fall back on, because then they were hitting the masses to say, this is what it is. We're not going to change, and you need to own up to it, or else you're going to die.
Yeah, yeah. Now, I want to switch gears here for a second because we've been talking to you guys mainly because you are frontline dads or you're frontline brothers on the front. Do you feel like you really are on the front line, or is this just business as usual for you?
Well,
I think. Oh, I'm
right.
sorry.
No.
Oh, I think it's. I think it's a little bit of both. I think it's a little bit of both.
Yeah, you
It,
gotta elaborate on that one, man. You gotta give me some more on that one.
it's always going to be business as usual, because we if you like Pierre, like if you like I said, I can sit and say that I love my job. I love it. Like I wouldn't change it. If I would do something else, I'd probably be lost because I love it so much. Getting into it, I had no idea what I was getting into, but just to see who you are once you become and you embrace your job. So it's business as usual because I feel, and I can only speak for myself, is because I go to work to work. I know that when I go to work, we're the only job, us and me. I mean, well, we're one of the two jobs where every person that we go and we help are total strangers.
Mm.
So you have to love your job. So that's when that's police brutality. Let's not get into that. Okay, we're gonna go. Let's just stay on task. Let me stay on task. But it's you have to love your job. You have to, because I can contract anything just from one day at work. So it has to be business as usual because I've been preparing myself since the day that I started in the job to be safe. Now, just to be a little bit safer, that's easy. You just gotta now we gotta wear gowns, and masks. But we've
Yeah,
always had gloves. We've always had gloves. Somebody want to talk? Let them come on and talk, Gary. Let them. But but I say it's business as usual because um, we this is what we do as healthcare professionals. We have to be safe because we don't want to contract anything. That excuse me, like when that person sneeze, like if we're somewhere and before we wore masks and somebody sneezed, everybody's turning, ducking it like the Matrix. We out the way, So
6 feet,
that
man. That thing's traveling six
right
feet.
that day. And, I mean, let's just go back to when we was little. What did they tell you? Arms distance. At the tip of my fingers. I need you back out my space. Now, why they told us that, we're not gonna get into that. But I need you in arms distance, just the way. Like men, as men, we're not close talkers anyway. As black men, we're not close talkers. And I'm gonna give you arms, and we're just gonna stay there. So business as usual. Yeah, I feel it's business as usual, but we have to be a little bit more careful. For me, I say a little bit, but somebody might think it's more because it's my profession and I've been doing this for so long.
Jalil, jump in there, man. Look, I see you. I see the hand on the face. I see you like you got something to say, brother. Let me hear you.
I mean, I I I agree, but I also think that as black men, we especially as professional men, you are used to having eyes on you when you enter a space, right? As a man, just as a black man in the world, you're used to having eyes on you. As a professional man, you're used to having more eyes on you, and as a man who's like maybe interacting with people in a way in the middle of this pandemic, there's even more eyes on you, right? There's your family that's looking at you like, what are you doing? What are you really doing? What do you believe about this? There's the people that you might be serving or interacting with. They're trying to see like, are you lining up with, whatever the recommendations are? And there's people that are casually just like observing you. So I feel like while yeah, I'm just going about my day to day, doing my job and interacting with the people in my community the way I normally do, with a little bit more precaution. I feel like there's a little bit of a microscope to some extent. Like people are like really looking. So yeah, I mean, I might, I guess the best way I could is the best example I can give you is an analogy of everybody knows that feeling of walking into a convenience store, department store, whatever. There are eyes on you, so you are perfectly normal in that space, right? All of a sudden, you are like erect and doing the things you're supposed to be doing. No hands in the pockets, not being weird. Get your business, get out of there because you don't want to cause any problems. And I feel like it's almost similar to that in that I know that people are definitely watching what I do, from my people inside my house all the way down to the people that I see in the community. So my ears are open, my eyes are open. I'm just trying to pay attention a little bit more to my own uh, actions to make sure I don't get too relaxed or maybe even overzealous in a way, hyperreactive. So those are my thoughts on that.
Okay, okay. Gary, let me hear from you, brother. Mark, I want you to.
Um,
Mark and Pierre. I'm eyeing you guys. I'm eyeing you. Gary, let me hear from you.
I'll say, as far as business as usual is because the world is going to continue, uh, regardless of this pandemic or not, or we're in a pandemic. So the world is still going to continue. Bills are still going to have to get paid. You still have to go out and do your job to be able to provide for your family. And then on the other hand, me working in the community, if it's providing food or if it's uh, going out giving out information, helping families deal with any type of situations they need to deal with. You got to be precautious of the information that you give, um, and that you're being safe doing it as well. Um, but again, I believe that going forward from now until the next few years, I believe everything is going to be different. I don't think we're going to be normal for a long time.
Mark, let me hear from you, and then finally
Gary,
Pierre.
Gary,
Well, you know what? I agree with with the with the brothers that on the one hand, you know, life goes on, right? You have to continue doing whatever you do to take care of your family, take care of your health. Um, but I think that it's business as usual is not really happening for anyone, right?
Mm,
Because, and I say that, and I use an example. My father just passed away about a month ago, and you know, in his death, yes, life went on, right? But there is an absence of his presence. And so as I try to move on, I realize that this void is there. So even if I try to just make things and go back to just being normal the way things were, it can't happen because that void it exists now. There's nothing I can do about that. I think because we are a communal people and we are in this collective, I think it's impossible for us not to be affected by even if we don't know the people that we see on the street. It's impossible not to be affected thinking about their lives have probably changed as drastically as our lives have changed. And this new normal, Gary said, you know, going back to the way things were, that just is not going to happen, right? Because as we transition on the other side of this, right, we are going to, our habits of, hopefully they will change. So we won't get back into this situation. But there's going to be changes. We're going to see the value in spending more time with our children. We're going to see the value of taking care of ourselves. As I believe Melvin said, he's seen people, Melvin or Gary said they're seeing people working out on the streets, right? So the value of these things, we're going to be more incorporated into who we are. So is business as usual going to work? Yes. But in terms of our lives being as they were or just normal or usual, that's over. And that's not necessarily a bad thing.
I agree.
Pierre.
Yeah, I agree with Mark 100%. So, but my thing is, we keep saying, what's the new norm? We haven't even reached it yet. So we're still in transition. So once we find what the new norm is, that's when we'll be able to be at ease. Right now, my norm is not your norm, or vice versa. We have several criterias that we all need to meet. But all in all, the foundation for us African American communities are the wives, children, putting food on the table, and interacting with people. So once we move that part into the new norm, then we'll be at ease. But right now, we're just walking blind.
Wow.
Right.
Go ahead.
Excuse
Who was that?
me, Brad. If I can, I agree with all of the brothers. But to get into detail, what I was saying about business as usual is like when we're trained as healthcare providers, where if we get a shooting and if and we go into that next call, we got to forget that shooting. And that's what I meant by business as
Right.
usual. Because you can't drag that shooting with you because that's a total different patient. You know what I mean? If you're emotionally distraught and you can't take it, you need to go home, flat out. So that's what I meant by business as usual. Because once you get that run, like we had a just maybe like 2 or 3 days ago, we had a 87-year-old woman was positive for COVID, and then right after that, we had a lady having a baby. So I can't go from feeling bad for this. And yes, it's there, but you got to have you got to have that quick memory that love it, forget it, and get out of there and start over again. It's like every time we go to each different run, you rebooting the computer and you plugging it back up because you got to start all over again. You can't take that with you. So
Right.
that's what I meant as business as usual. Like if I'm doing CPR on this patient, and once we finish, we go home, we decom, we clean up, I sit down for a hot minute, that gong go off, I'm back, I'm starting all over. That call, gone. Business as usual. I'm back. You got to be back in action, because if you don't, that's going to be your downfall, because that's when you slip. That's when you're not thinking 100%, and that's when you get caught slipping. And that's when you do things and you forget to do things like your body surface isolation and all of that stuff. So you have to be business as usual after every call. So that's where I kind of get it from, because it kind of helps out in life. Yeah, you're going to remember it, but you can't let it drag you, because if it drags you, now you're thinking about that when you should be doing something else.
Absolutely. Hey, thanks for that, Melvin.
Can I,
And I
can
just let
I
me just
can I respond to something Gary said?
sure, sure, sure.
Sorry. So Gary said something earlier about the younger people sort of questioning and not hearing inconsistent information, questioning government, questioning authorities. Um, and I thought that was really interesting, especially as Black people in this country have been given a raw deal by uh, governments, medical authorities, authority figures in general for hundreds of years, literally, and it's still happening. So I hear that. I also, I'm a trained scientist, so I also believe in that process. Um, and so to put those two things together, I think that it's a good thing for people, not just young people, but just for people to question uh, what they hear. I think it's a good thing to have dialogue about it and difficult conversations. I think it's a good thing to look for additional information and insight from sources or whatever. I think it gets murky when it there's no line for what is credible and what is not. So in the scientific community, there's a line. It's like certain kinds of materials are considered credible and some are not, right? And that's when it gets a little bit murky. So I never want to be a person that's telling people to not question authority, not question government, not question science. I think that that's a healthy kind of way to be, especially for people of color. Like we need to like be asking the hard questions, and also accepting the information once it comes. Because the problem is when you ask those questions, you look for the information, and then the consensus from the scientific community says this is where we are right now, and then you say, well, I don't know if I want to accept that. Now you enter a cognitive dissonance kind of thing, uh,
Hmm.
and that's unhealthy, right? So we want to question, all right, but then when you get the answer, if that's looking reasonable and making sense, then let's not try to go into like the dregs of the internet to find something that Bobby Joe wrote from the bottom of Florida, and then take that as equal weight to the CDC, right? So
Right, 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 right,
that,
right.
I think as men, as black men, as professionals, we should be able to like, hold that line and say, yeah, let's talk about this, but let's just be careful about this information. I thought that was a
And
good point you brought up, Gary. I just wanted to comment on it.
hey guys, I want to ask you a huge, huge favor. There's more we have to talk about. We try to keep this just around an hour, so I would love to do a part two of this Frontline Dads. We're gonna schedule something out. Hopefully, I can have you all back because there's some things I want to talk about that we kind of touched on, but we never got into. I want to talk more about our community. I want to talk more about depression. I want to talk about something what someone else said earlier: the gift and the curse of your industry that you work in. And then the paranoia, and then finally, like the family work life balance. But I want to leave everyone with a one question. So this is going to be either or question. Not a lot of discussion, but so my question to you: do you prefer pre-COVID or post-COVID times? Pre or post? I'm gonna answer first. I prefer post because I'm a borderline germaphobe, so like I think we needed to reset anyway. I felt like we were way too close. Like I was the guy travel a lot for work. I travel with my own Lysol spray and wipes. So by the time I hit that hotel room, I'm wiping everything. I'm spraying everything. That was my world. I never caught a cold on the road. So I'm asking you guys, what do you think? Pre-COVID, post-COVID? What's your answer? Let me go with Pierre first.
I'm a post-COVID.
All right, Gary,
I'm gonna say post COVID.
Jalil,
Definitely post COVID.
Melvin.
Post COVID, I'm saving a lot of money.
Mark.
I'm gonna say definitely post because I think the pause has allowed a lot of us to go in and do a lot of introspective thinking. This has been great for a lot of people.
Indeed, indeed. I can tell anybody I discovered I really, really like my wife and my kids. So we're okay. We are
So
okay. We look, business as usual in this house. Everybody, nobody killed each other. Hey, I see you there.
Hey, this is
all right, all right.
What's up? Hey, thank you again, gentlemen. We appreciate you. And thank you for tuning into the Black Fathers Foundation. We'll be back in a couple of weeks with a part two of these frontline dads. Thank you very much, gentlemen. We appreciate you, and we're out, okay?
Thanks
Take
for
care.
Thank
having
you
me.
guys. We
all
always
right.